Second lecture is about antimicrobial agents used in industry. So today we will start the about it. So the so as you guys all know that in antimicrobial agents are used also in industry. ठीक है? So the first thing we will discuss about them will be their principles of therapy. Okay, so there are two factors to be considered. One is patient and causative organism. Okay, so first we will discuss about the patient one. Okay, the patient factors include history of allergy, renal and hepatic function, resistance to infection, ability to tolerate drugs by mouth, severity of illness, age, and if female, pregnancy, breastfeeding, and taking oral or contraceptives. All these things are to be care about. Okay, moving forward. Moving forward, we will have the second thing is oral cavity organism. There are more than 400 species that are involved in the oral cavity. Both they are both aerobic and aerobic. Anaerobic are 10 to 100 times more. Okay, you should know that. Then moving forward, there are systemic indications for the antimicrobial therapy. So when you are going for a treatment of infections, there are several infections, a severe infection of dental origin, which includes cellulitis, acute osteomyelitis, severe pericoronitis, deep facial infections. Okay, severe acute ulcerative gingivitis with signs of systemic involvement, and sinus infection as well, complicating an oral enteral fistula. You should know that. Okay, these are indications when you give systemic antimicrobial therapy. Okay, moving forward, there are general prophylaxis where you are also giving these antimicrobial agents in the patients which are debilitated and undergoing surgery, endocarditis patients, anemia patients, blood discharges patients, patient with diabetes, patient who have undergone radiation therapy of jaws and face. So you should give as a general prophylaxis. Okay, transplant patient who requires an oral surgical procedure. So you should know that as well. Okay, anatomic disease. So patients with anatomic disease, you also give antimicrobial agents, such as the case of a pulpitis. Pulpitis is a condition in which pulp nerve of tooth becomes inflamed and causing the pain and pressure on the tooth. Okay, so basically it's a condition in which the nerve of the tooth becomes inflamed, and it causes pain and pressure in the tooth. Okay, so what can be the cause of pulpitis? Basically there are two types of causes: bacterial cause can include caries, cracks in tooth, or periodontal pockets. So you should know that. And traumatic, there are causes which are traumatic includes crown fractures, root fractures, bruxism, and abrasion. Okay, okay. So pulpitis continued. There is another factor which can lead to the pulpitis, which is iatrogenic. You should know that it can lead to it can be due to the heat generation, depth of preparation when you are preparing, and pulp, and more you have exposed pulp exposure, or toxic disinfection. Okay, there are two types of the pulpitis, basically: reversible pulpitis and irreversible pulpitis. Reversible pulpitis may be reversed when cause, as the name suggests, when the cause of pulpitis has been removed and the tooth is prepared. So basically when the cause is removed, pulpitis, the pain goes off and the tooth is basically repaired. Okay, then there is no pain, and so it is basically reversed. It is elicited by the stimuli. It is sharp pain. In reversible pulpitis you have sharp pain, and the pain is less than 20 minutes. Okay, it is unaffected by the body position. This is the main thing. Okay, and it is easily localized. So reversible pulpitis is basically easily localized. Irreversible pulpitis, the cause of the pulpitis has caused irreversible damage to the nerve, therefore regarding resulting in the need for the root canal therapy. So basically it has basically it caused irreversible damage to the tooth. ठीक है? So that's why you need root canal treatment for this. Okay, therapy. So basically the irreversible pulpitis is the pain is spontaneous, and it is kind of a dull pain. ठीक है? And it is more than 20 minutes, and it is affected by the body position. Okay, and patient may complain that basically it is very difficult to localize as well. Okay, So this is the picture. You can see that caries lion approaching on the pulp, basically here, and pulp becoming severely inflamed, causing acute pain because of confined space. Okay, so it is causing basically irreversible pulpitis. So this is a periapical abscess. You can see and cellulitis. This is, you can see it as the first the started with the with caries. The pulp become necrotic. Then it led to spread to the periradicular tissues, periapical abscess, and apical peritonitis, and causes the cellulitis, spreading of infection into the surrounding tissues. Okay. Pathogenesis and bacteria involved. Basically, injuries result in inflammation led to necrosis of the pulp. You can see that, and the necrotic tissue is usually invaded by the bacteria. You can see that in the picture, sequestered when within the enclosed environment of root canal system. This mixture of necrotic tissue and bacteria cannot be removed by the body. Facultative and obligative anaerobic oral bacteria, non-pathogenic and non-proliferative. These are the bacteria involved. Immune mechanism reacting to the toxin and enzyme produced by the bacteria, as well as to the mediator released from the inflamed and necrotic tissues. Okay. So treatment, what is the treatment? If there is a reversible pulpitis, we do filling in the case of reversible pulpitis. If there is a case of a reversible pulpitis, then we do normally root canal or extraction. Okay. There is no circulation within the necrotic pulp or an abscess. It is unlikely that antibiotic would reach the bacteria in the therapeutic concentration. So this is the main thing you should know that. Okay. Acute apical abscess. So it is a basically, as the name suggests, it's a severe inflammatory response to microorganism or irritants that leads out into the periradical tissues. Okay, moderate discomfort or swelling with or without draining sinuses. Okay, you can patient can present with or without draining sinuses. Systemic involvement such as raised temperature. Patient may have increased temperature or malaise, like feeling of not feeling good. Teeth tender to palpation and percussion. Okay, this is the main thing. Tender to palpation and percussion. Well-defined radiolucent area in the periapical region of the tooth. Basically, when you do radiographs, X-rays, periapical radiographs, there will be a well-defined radiolucent area in the periapical region of the tooth. Okay, so like you can see this abscess adjacent to the tooth. So basically, these are the abscesses which are adjacent to the tooth. Okay, or but what's the treatment of this removal of the ligand? Basically, drainage by opening the tooth, the okay, or incision and drainage of fluctuant area, and antibiotic not required until cellulitis. This is the thing. And once the acute symptoms have subsided, then root canal therapy or extraction may be performed. So this is the thing basically. Okay. So what is cellulitis basically? So cellulitis is a more severe manifestation of localized abscess. You should know that, in which the abscess and reaction to the abscess disseminates often rapidly into the other tissues and spaces. It is diffuse soft tissue bacterial infection, dissection of the facial planes between the muscle bundles as a result of progression of osteomyelitis, sinus opening on the gingiva, pain, erythema, and swelling. You should know that there is pain, there is red color and swelling, regional lymphadenopathy, and fever. Okay. So basically, bacteria involved are group A Streptococci, Staphylococcus aureus, Streptococcus pneumoniae. So basically, this is a very much important MCU. And in exam, there is also can UQ can be coming as well. So I am saying do prepare it very much. Group A Streptococci involved, Staphylococcus aureus, and Streptococcus pneumoniae involved. Okay. So patient with the cellulitis can look like this, like facial cellulitis. Okay. तो मेन ट्रीटमेंट ऑप्शंस आर पेनिसिलिन रेजिस्टेंट पेनिसिलिन ठीक है ओके फ्लक्सुलसन 250 mg 6 hourly by 1 IV 250 mg 6 hourly dose double in severe infection beta lactam clavulanic acid augmentin which is very much common 625 mg 8 hourly ठीक है for 5 to 7 days or for penicillin allergic patient ciprofloxacin 500 mg 12 hourly for 8 plus metronidazole. The symptoms do not improve after 24 to 36 hours of treatment. Intravenous antibiotics should be given. Okay, in very resistant infection, clindamycin or vancomycin. Okay, you should do this. Acute osteomyelitis, an inflammatory condition of the bone that begins from the infection within the bone cavity. Uh, uh, then teeth tendon to percussion. Difficulty in jaw opening is often, you can see this, a pus discharge into oral cavity and over the skin, fetid odor. You can see the fetid odor as well. Bacteria involved as Staphylococcus aureus, Streptococcus pyogenes, and spirochete. Okay. Treatment: antibiotics, amoxicillin, cloxacillin, clindamycin, metronidazole, zole, erythromycin. So analgesic or sedation to reduce the pain. IV fluids are administered to avoid dehydration. In this case, blood transfusion may be required in case with low HV or hemoglobin levels, high protein diet and nutritional support, hyperbaric oxygen therapy. So you should know that hyperbaric oxygen therapy is given in the acute osteomyelitis. Okay. So you can see the radiograph of the osteomyelitis. In this case, there is a very big radiolucency in the jaw. So this was our today's lecture. I hope it's get you can get this. So thank you very much for this. Allah Hafiz.